slight victory pushing back on the Senate bill this year. And then we had to turn our eye to the state. HCB3, which is House Committee Bill 3, was a response to the governor's proposed budget cuts to social service programs, including nearly $16 million cut to Medicaid programs. The governor's budget recommendations increased the level of care eligibility scoring requirements, put a 60% cost cap in the consumer-directed services program, and cut funding from all home care providers across the state, including home health, hospice, home and community-based services, and private duty nursing. While the eligibility requirements have been amended from the governor's proposal, many will still find they no longer qualify. The budget also still cuts funding of payment for services and still leaves in place a 60% cost cap in the consumer-directed services program. These cuts will create access issues for seniors and for those with disabilities. HCB3 will set up the Senior Citizen Protection Fund, using excess funds from other programs to allow the state to maintain the current level of personal care services. With overwhelming support for this bill from the Missouri Senate, the House passed the bill, and in June, Governor Greitens vetoed it, leaving an estimated 8,000 Missourians in fear of losing their services. To better understand what we're fighting, I want to start with some basic questions about what these budget changes mean. Carol or Colleen, if you wouldn't mind answering. Can you explain a bit about how the scoring system works and what will happen to the people who score between 21 and 23, which are now going to fall under uncovered care?
Currently, there is an assessment process in place that the state of Missouri uses. And they are, anybody who is in need of services gets assessed by the Department of Health and Senior Services, actually Division of Senior and Disability Services. And the assessment is called the RAI, and it actually assesses different needs. And I wish I would have brought a copy of each section with me. But basically, it looks at what the participant possibly could need related to different types of services, whether personal care services, medications, their home environment, whole different aspects. And it then, depending on how they answer those questions, it plugs in a score for them. Currently, if a score comes out at 21 or higher, then they're eligible for services. This particular assessment does actually go in points of 3. So either you're a 21, you're a 24, you're a 27, and so on. So usually it's kind of an algorithm and a computer-based type assessment. So there's really not a lot of manipulation with it. However, it does seem to score higher for people who are on multiple medications and people who visit the doctors often. So, what we have found is maybe we've got some younger quadriplegics who need a lot of care, need a lot of care in the mornings, helping them get out of bed, a lot of care in the evenings to get back in bed, those type of things. And they're healthy, they work, they don't go to the doctor very often, so they're going to score much lower, but that doesn't mean they don't need the services. So there's kind of I think a fix maybe, or a way we need to kind of look at the assessment process a little better to make sure, especially in times like this when we're wanting to cut people off of services just because of a score. I think we need to find a system that really gives the services to the people that need them. Does that help?
Yeah, I hope so. Could you go a little bit into the decrease, the cut in the funding for provider payments, and maybe how that will affect services?
So the governor's budget, his initial budget included a 3% cut to all providers. It actually gets a little more complicated, and I do want to bring this issue up regarding private duty nursing, and I'll get to that in a minute. But the governor's budget came out as 3% reduction in provider rates. And we all know, a lot of the providers know, a lot of you guys might not know, but I think these people to the left of me know, provider rates are low. It's hard to provide the needed services for people when you don't get reimbursed much from the state. We understand the budget issue, you know, and they do the best they can. But it is hard on providers to be able to provide the services, pay a decent wage to these workers. We all know home care workers, it's not glamorous, it's hard work, and a lot of them are making minimum wage. So providers also have to, you know, they have a business to run. They've got to pay insurance for these workers. They've got to pay liability insurance, workers' comp insurance. A couple of years ago, we were also faced, the home and community-based community, the in-home and the consumer-directed providers were mandated with a telephony requirement, which means, or an EBV requirement, which means they have to do their time in and out with their attendants and their aides electronically, so there's no chance of possible fraud or those type of things. It was an unfunded mandate. Agencies had to spend hundreds, thousands of dollars on this system. It's not an easy system. They've had to train their staff. So those type of things are constantly facing these providers. We have a lot of things come down from the federal level. Recently, the past 2 years, we had a companionship exemption, which meant home care workers weren't eligible for the overtime rule because a lot of them are live-in companions, actually have to work extended hours. That exemption was taken away. Providers had to start paying overtime. The Department of Labor also came down hard on these providers and said you've got to now start paying drive time in addition to overtime. And we all know in the rural communities, sometimes it's, you know, an hour in between patients, that type of thing. So providers were then having to pay for that. So they've been hit hard with all these new regulations and unfunded mandates, all still while trying to provide the services for that specific amount. And then when they come in and want to take 3% of that away, when over the past 2-3 years you've had all these additional mandates come down, it's very difficult. Providers are struggling right now. A lot of them have already laid off many workers. They've limited overtime for a lot of the workers. We all know in the industry that continuity of care is a big issue. So if you've got a nurse that goes into the home, they like only one person coming in. They know that person. That person knows them. They know their routine. But when you've got to start splitting shifts, you know, it becomes an issue. We already have a workforce issue anyway. Like I said, a lot of the home care aides don't make but minimum wage. Providers do try to pay them a little bit more, but it's difficult. So we already have a workforce shortage, and trying then to continue to provide these services when you're getting reimbursed less from the state is very difficult. You know, a lot of the smaller ones could go out of business, which, you know, then again, we don't have providers. We're not going to be able to provide the services. So unfortunately, it's a snowball effect.
Colleen, would you like to speak to that on the position of nurses who are trying to fill these things?
Sure. As it's pretty obvious that when the budgets are cut and you're making those choices, nurses like myself have less employment opportunities. We also then have to look at how these patients end up having to go to the hospital with complex chronic issues that cost just way more to take care of in a hospital than at home. It's a complete loss of dignity not to be able to be cared for in your home. It creates, it really affects anybody. If you're in the hospital, that affects you. If you have the best insurance and you think that that's going to get you by, well, cuts like this make it very hard on hospital nurses, which is my background. The lack of expansion to Medicaid services, many people think that that doesn't affect them. But in reality, we have hospitals closing as a result of that Even working in bigger hospitals, I've been a part of many budget cuts, and it does affect the quality of care that somebody with the best insurance gets in a hospital.
Thank you. So the House Committee Bill 3 was passed along with the budget to try to save some of these programs. It took funds, put it into an account, and it was supposed to cover these cuts. We did have overwhelming bipartisan support during the session. We also invited Senator Kayla Rowden and the newly elected 50th District Rep. Senator Rowden was contacted to attend this evening, and he sent back an email supporting this measure. So he supported it in the regular session, and he continues to support it in the veto session upcoming. So there is bipartisan support for this bill, and I would like to address Kip and Martha, if they wouldn't mind kind of explaining. The governor has called this bill a gimmick, stating that funds were cherry-picked by politicians. Could you maybe explain the process and further explain how those funds were chosen?
Yeah, sure. So, this was a bipartisan a bill that passed in the last few minutes of session, actually. We got it over the line. And really, it was a solution to buy us some time, because we know that we are in tough times when it comes to the budget. But folks worked really hard to identify different unused reserved funds from different departments around the state to fill that gap in those 8,000 cuts to in-home nursing services and in-home care. And so, past the last 5 minutes, we, again, we're trying to buy some time. I think that there's a lot of things that we can do when we're looking at our budget crisis down the road, that we can address this going forward. I think some of the things that we were hoping to do is, in the meantime, do this fund sweep, make sure that those caregivers have jobs, make sure that people can stay in their homes and they're not risking being, having to move out of their neighborhoods and out of their communities into institutional care, while we as legislators try to come up with some budget solutions. Some of those being, really taking a hard look at the $700 million that we give away in tax credits every year. It's really past time that we sit down and have a serious conversation about that and how that could save us money. At the federal level, the ACA is still there. It has not been repealed. We are still, unfortunately, one of 19 states that's yet to expand Medicaid. We can bring those federal dollars back into our state. We're also a state that has some of the lowest taxes when it comes to tobacco and gas. And so while those funds are designated to certain programs, it does also free up money when we look at raising taxes on those different things. So those are some of the things that we're trying to buy some time, but in the meantime, offer some security to those families in our communities across the state. So I wonder if you want to elaborate.
We're happy to. So the House Committee Bill 3 in its original shape was not bipartisan at all. When the House Committee Bill, when it originated in the House, it originated in Budget Committee. That bill was actually set up to cut the renter's portion of the circuit breaker tax credit program and roll back basically an $800 credit for seniors renting and take it directly out of their pocket in order to fund in-home services. We were unable to stop that in the House. They got to the Senate, and then fortunately cooler heads prevailed and said, hold on, we cannot rob from seniors in order to continue the in-home services at the current level. So there's a bipartisan solution that happened in the Senate. It was not in the House. On the House side, me along with Martha and several other Democrats had proposed the solution to be, at that time we were not looking at fund sweeps. We started looking at fund sweeps soon after, but we proposed stopping the implementation of some tax cuts, in particular some special interest tax cuts that have really led to the budget crisis that we're currently in. FY 18, which we are now currently in, is bad. We had, $450 million in cuts just from the budget, an additional $250 million in withholds. FY 19, I'm going to go ahead and tell you this, it's not going to look any better, and it could even be worse than FY 18 as far as cuts. It's not looking good. And that's because, again, we had such a precipitous drop in corporate tax collection, corporate income tax collection due to some really poor tax policies that we were, our answer in the House was at that time, let's delay implementation at worst. At best, let's go ahead and roll back some of these special interest tax cuts and put that money towards in-home services and other services that were receiving some significant cuts. That didn't go anywhere. Those amendments that were offered were ruled out of order, and we weren't allowed to. I think we were allowed to vote on one of them, but the other two were ruled out of order. But the House members at that point then went and started working with senators, came up with the idea that the funds sweep, and it's not a sweep, but it is sweeping some funds. It was proportional, and it gave the Office of Administration a lot of power in this as well. It gave the commissioner, Sarah Steelman, the ability to identify where the funds could come from and how much would come from each fund in order to be proportional, make sure that no fund was dramatically cut. House Committee Bill 3 is just kind of a one-time, one-year fix, but allows us, it does buy us some time to hopefully where we can come up with a better solution in the future.
So because this bill was passed as a budget fix, can you maybe speak to the fact that the budget impact of Missourians who are not able to stay in their home any longer? Because that really seems to me what this bill is allowing people to stay in their home and have the service that they need. So what will the impact be on our economy? Will this really save us money?
No, I don't think it will. I mean, it was a short-term solution for a long-term budget problem. But in the cost savings in the first year, maybe first couple of years, will be significant, but long-term it won't be by any means. It's going to, just like we rolled back the Missouri prescription drug program also, which will lead to less compliance with prescription drugs for seniors. And this is going to lead towards more hospitalizations, deterioration of health for people who have been receiving in-home services, which is a very cost-effective program for the services that are delivered. As already been said, unfortunately, we don't pay the in-home workers nearly enough. And what services they do provide, they provide, excellent care for the dollar value, and they make sure that people continue to take their medication and continue to function and make sure that people can get up and get dressed and get out to work, get out the door and work and pay an income tax as well, and help keep costs low. Anecdotally, we've already heard some people here in Columbia who have had cuts to service, and one person in particular who was hospitalized since that time, and likely due to decreased services. So, and that's just one anecdotal story. There'll be many across the state.
Yeah, and I completely agree with Representative that it's not going to save the state money at all. We all know, I think some of the statistics that we've been giving out is that an average day cost of a hospital stay is $2,000. The average monthly cost of home and community-based services is $1,139. So, we have done a great job in the state of Missouri over the last 5 to 10 years in advancing our home and community-based services. And I feel like we're just taking steps backwards. We've done such a good job that the budget numbers got higher and higher. And I feel that sometimes when the administration is looking for budget cuts, they look at numbers on a piece of paper, and they don't look at people and how it affects those people. And because that number was growing and growing and growing over the years, we were on the chopping block. So in the end, is it going to save money? I mean, I think all of us can say for certainty, no. If you take those 8,000 people that are going to lose services, and 5%, 10% of them end up in the hospital once or twice, you've just spent plus thousands and thousands of more money. And we all know, I mean, they're going to go to the hospitals. There's no other place for them to go, and Medicaid's going to have to cover that. Is the solution easy? I don't think so. We probably could have came up with something if it was easy. But I do think it was worth trying to get the extra time to discuss it, to work on it. And unfortunately, we did not get that. And who's going to suffer in the end? It's Missouri's elderly, disabled, our most vulnerable who need the help. And a lot of things that I had heard during session was, well, and I think it's unfortunately a stereotype sometimes when we talk about the Medicaid population. They're like, well, they just need to go get a job. Well, we're talking about disabled people and we're talking about the elderly. Most of the elderly have worked their entire life, and unfortunately health sometimes forces you into, the Medicaid system. So I think we're, we just need to look at who we're talking about here. We're not talking about numbers on a page, we're talking about actual people.
I have a question for you. So me and Rebecca were talking before the town hall today, and I asked her, and we're just kind of going back and forth. So if you have somebody on home care that loses services, they go into the hospital, they have a couple of hospital visits, and then they need institutional care or they need the services of a nursing home. What if they don't qualify for that because there's also a 3% budget cut in nursing homes? Who's going to take care of them? Because not everybody has reliable enough family to do that. What is going to happen to those patients?
And that's an issue, and hospital discharge planners are going to have a problem because they're going to have a hard time trying to discharge these people. They have federal regulations that they have to follow for discharge planning, and it's headed towards you don't discharge unless they're going to have some type of service, whether it's institutional or in-home or something, and they're going to be limited on where these people can go. Again, just by increasing the eligibility points doesn't mean somebody doesn't need the service or the care. So yeah, it is going to be an issue.
Are there any plans beyond this fiscal year to protect these programs? Are there anything coming down the pipe that we should be looking for?
I mean, kind of to reiterate what I said earlier, I think we need to have some serious discussions about things when it comes to like evaluating our tax credits that we give out, $700 million a year, looking at Medicaid expansion. I think part of it too, as citizens, is making sure that we elect people that aren't going to grant more corporate tax cuts for the wealthy and are actually going to stand up for citizens and everyday areas. And so, and also looking at different revenue streams that we can explore to bring more money into our state budget.
I mean, I'd love to have a conversation about some of the tax cuts that we've implemented and continue to implement. This next year will be the second year implementation of Senate Bill 509. The second year implementation will be significant. This year is about $90 million. Next year it'll at least be 180, potentially more than that because of the way the bill is written. And, I mean, looking at tax credit programs, like as I said before, and I feel fairly confident saying this, FY19 is not going to be an easy budget year either. I am somewhat hopeful that, it pains me to say this, right? I'm somewhat hopeful that that individuals with disabilities, seniors, took their lumps this year in the budget, and I hope that there is not a renewed effort next year to go after these vulnerable populations. I fully suspect, public higher education to take some significant lumps again next year, just because that's an easy place to go. Unfortunately, an easy place to go when you're balancing the budget, because you can pass on the cost. But like I said, there will be budget cuts this next year, probably likely. We need to do everything we can to limit them, and we also need to do everything we can to look at sensible solutions moving forward to fix our budget problem. There's no reason why we can't talk Medicaid expansion continuously from here on out. I don't see the Affordable Care Act going anywhere. And the money coming in for that program could definitely help pay for. I mean, we could have reduced these cuts this year, or not even had cuts to that services if we actually expanded Medicaid. So.
I just want to add one thing. This is a serious issue, and it's definitely a priority. I know for my Democratic colleagues. And I also think we need to recognize that, I mean, we do need to look at this down the road because we have a significant aging population and the grain of America, and the baby boomers, and so this is something that we really need to take seriously.